At that moment, I knew I am going to quit being just an endodontist. Hello everybody, I'm Rafael, I'm a root canal specialist and I am going to quit endodontics. Now in this video I'm gonna talk about the good, I'm gonna talk about the bad, and I will show you the ugly. So the good thing about endodontics, let's start with the good thing. But before I start, I will give you a little bit of a backstory how I got into endodontics. So the first time I got into contact with endodontics was in my third year of dental school. For some reason, I immediately fell in love with it. I have a theory about this. So probably I always was a little bit different than many others. I think if you would ask some of my former classmates, they would concur with this. So everybody in dentistry hated endodontics. All my students, my fellow students, but also now even in my professional life, I give a lot of courses, and endodontics is one of the most hated subjects for dentists. So because it's hated by many, I think for some reason then I want to like it even more. Now, of course, this is not the only thing, but looking at my personality, this might explain a little bit. Another thing is that I have a very, very chaotic mind. My mind is always busy doing this, then that. Oh, I have a good idea. I need to do this. So I have a very chaotic mind, and endodontics is one of the few aspects in my professional life that really makes me focused on one task, because you need to be super focused to be able to be a good endodontist. So I think this being different and being super focused on one thing is one of the most important reasons why I like it. And of course, this is also a good thing, because the good thing about being an endodontist is you don't have to constantly do different things. I mean, as a general dentist, you often have to do this, and then you do a root canal treatment, then you do a prosthesis, then your assistant calls, we have an emergency, patient needs some stuff, I don't know, whatever. Anyway, you're constantly, during the day, you're constantly busy with a lot of things, and for a person as me, this would be maybe horrible. However, if you will continue watching the video, you will see that it's gonna be my choice to do. This is going to be quite a challenge for me as a person. So, but the biggest advantage about being an endodontist is you can focus on one treatment and one treatment only. It's very, very relaxed in a sort of mental way. Another thing, which is a great thing about endodontics, is the complexity. So endodontics is not the easiest specialty in dentistry, far from. It's most of the time it's pretty complex. You work in an opening of a few millimeters wide. The canals are even smaller. You have to find your way in these canals, bypass an instrument, bypass some ledges, whatever. For some reason, the dentist couldn't do it, and then he sends it to you. So it's very complex, but when something is complex, it's often very satisfying. So think back maybe when you were in high school, or if you were watching this and you're in high school and thinking about becoming a dentist. When you have a math problem and you solve it and it's super easy, it's like, I solved it, good. But if it's very difficult and it takes you quite a while to solve this and eventually you get the result, it's more satisfying. It's the same with endodontic treatment. So I do some easy treatments, and these easy treatments are a nice rest, let's say it. But it's very rewarding if you have a very complex case that many other colleagues would say, yeah, this tooth is lost, and you somehow manage to be able to fix it. You are able to do a good root canal treatment and the teeth can be saved. Even after a very complex treatment, this is very satisfying. So complexity can be very rewarding. Another thing is the patient. So if you do endodontics, normally you should work constantly on the rubber dam, 100%. No root canal treatment ever should be done without a rubber dam. One of the advantages is the patient cannot speak. So I work in laser focus on the treatment and the patient just shut up. He or she just shuts up. That's it, pure silence. And sometimes this is nice. Depends a little bit on the patient. Another thing, which is a good thing, is the ego boosting. I'm not gonna deny this. Often when people say like, oh yeah, this tooth is lost, but we'll send it to an endodontist. Maybe he or she can treat it, and maybe he or she can save the tooth. If you manage to do this, it's very rewarding, because everybody's like, oh my God, how did he or she do this? How did they manage? And then you can be a little bit, it's just the skills. So it's a good ego boost. And then often I get to hear this, but I have to like debunk the myth a little bit, the payment. So most of the time I of course charge more for a root canal treatment than a general dentist would do. However, even though I charge more, it doesn't mean I make more money, because endodontics, most of the treatments take quite some time. So yes, I charge more than the normal dentist would do. But of course, because I take way more time for my treatments, and also because of the complexity of the cases that I get referred, I don't do many treatments a day. Now I can say this, I have an ex-girlfriend who is a dentist, and when we looked at our pay, I wouldn't say there's so much difference. Also, if I compare it with some of my friends who are general dentists, it's more or less in the same ballpark. Maybe it's different in other countries, but in Belgium, an endodontist doesn't necessarily make more money than a general dentist. Now, enough about the good things. Let's talk about some bad things in endodontics. When I was talking about the good things, I ended with the prices. And now I will start with the prices, because it's also one of the bad things, and not necessarily the price I charge, because I think as an endodontist this is a reasonable price. I mean, I would constantly have to explain patients why I am charging what I charge as a root canal specialist for just a root canal. This is it. It's always just a root canal for the patient. It's often only just a root canal for the referring dentist, but most of the time it's never just a root canal. I mean, if it was just a simple root canal, your dentist would have done this themselves, of course, but they refer you for a reason. Most of the time because the case is too complex. And because I'm dealing with these complex cases constantly, I require more time, I require more materials, but most of all, I require more skills. So the patient is paying for the materials, the patient is paying especially for my time, but also for my skills. And I don't think there's anything wrong with this. But of course, you constantly have to explain this to patients. And maybe some of you are patients and think like, oh my God, I don't agree, the endodontists, they overcharge. Well, like I said in my first video, I'm going to upload videos every Thursday from now on, and probably one of the future videos is going to be how is a root canal performed, so you can at least see what we all do. And another thing is why does it cost so much? So I will make a separate video on this. But constantly having to explain this is really something that annoys me. It's always the same explanation you have to do. But besides prices, it's always the same explanation concerning the treatment. I just do root canal treatments, root canal retreatments, and surgery. And I think 90% of the time, it's always the same problem. Okay, the previous treatment was not done perfectly, or you had a cavity and the pulp is becoming necrotic. Stuff like this, more or less always the same and always the same explanation. And this gets boring, which brings me to the second thing that is not a good thing about endodontics. So it gets boring, not only with the explanation of what you need to do, but also the treatment itself. It's always the same. I never go in the morning into my office knowing what I will do, because I already know it's going to be root canal treatments, root canal retreatments, or apical surgery. It doesn't matter. After now 16 years of working as an endodontist, I'm pretty all-rounded in most of these things. It was different, of course. If you're doing your first root canal treatments as a dental student, it's always super exciting, and you're a little bit scared, like, oh my God, it's difficult. How am I going to manage? Now, when I graduated as a dentist, I could do primary treatments pretty well. I enjoyed endodontics, so I focused myself on it. Then I did my residency, which of course in your residency you become an endodontist and you start to learn to do more complex cases. And after I graduated as an endodontist, I can say that primary treatments were no problem anymore. It didn't make me super excited anymore. Retreatments, well, if it was a difficult molar retreatment, I still was a little bit excited, a little bit fearful, like, oh, am I going to manage this? But still, after a few years of working as an endodontist in private practice, these retreatments now become routine, and the only thing that's left is apical surgery. And even apical surgery after a while gets more or less routine. So I am now at a stage that there's no challenge anymore. Of course, sometimes it's super difficult, and I enjoy those cases, but 90% of the work I do for me is now routine. And this is the problem with being a specialist. You focus on such a small area of dentistry that, yeah, after 15, 16 years, it gets boring. And I don't think that I could just do endodontics for another 30 years. So this brings me to the third part, which is failures. So the third thing that's bad, it's failures. Of course, we get failures, which is difficult to explain because you're the specialist and it failed. But I try to explain this beforehand because, you know, explanation is more easy than justification. So, but if it fails, it's still your fault. Even after 2 or 3 years, if it fails, it will always be the fault of the endodontist. The prosthodontist or the general dentist will never ever take responsibility. It's just something they don't do. It doesn't matter if the restoration they put on this was crappy. It's the fault of the root canal treatment. This is always the case, which is very frustrating. Now, coming back on this being bored of just doing root canals, after a few years I started to do direct restorations myself, which also allows me to complete the full treatment from root to crown. And this year, some of my referring dentists were asking me if I would like to do the indirect restoration, so crowns and onlays. And of course I said yes. So this is now something I will be focusing on more. So this is why I am quitting endodontics. I'm not gonna be just doing root canal treatments only, because it's one of the biggest frustrations. So we have the boring part, but also frustrations. And frustrations, let me explain this a little. Often you work your ass off as an endodontist for 2 hours or 4 hours, it doesn't matter. You do everything you can to deliver a nice root canal treatment. Then you see this patient back after 2 years and you see the horrible restoration, which is on this tooth. And this frustrates me because I do high quality work, and so I expect some high quality restorations on top of my root canal treatments. And of course you might say, oh, he's biased because you only see the crappy work. Could be true, but I see a lot of crappy work, a lot. Basically on a daily basis I see things which are horrible, and just multiply this by years that I've been working. I've probably seen hundreds or even thousands of cases where the general quality of the dental work is very poor, and this frustrates me. So this brings me to the final part of this video, and this is going to be the ugly side of being an endodontist. And I told you I will talk about the good, I will talk about the bad, but I will show you the ugly. So I am going to show you one case. A few weeks ago I saw this patient, and it's just horrible. It's horrible, and at that moment I knew I am going to quit being just an endodontist. So this is the ugly side of endodontics. I told you I would show you the ugly side. So here's a case. We saw this patient in 2021 for another tooth, but I remember that the patient complained and he said like, yeah, I think something in my lower right jaw, I think my tooth is broken. And we took a look, and indeed, yeah, there was a part of the tooth that was broken. We took an x-ray, the teeth were still vital, no problem here. Some caries on the lower first molar and on the lower second molar. And we said, look, this is not a big deal. You just need 2 fillings. We'll make the report and we'll send it to your dentist. And if the dentist does 2 fillings, should be okay. So, flash forward. This is 2022. And as you can see, the filling on the first molar, it's horrible. It doesn't fit. It's also super deep. So the nerve got necrotic. Now he had an abscess. He had swelling, pus. They did a temporary root canal treatment. And of course, they didn't do anything on the second molar. So the caries was still there. And it's just horrible. Also, if you look at the pictures from inside of the mouth, look at this restoration. This restoration is just 1 year old. Actually, it's less than 1 year old. It's like 9 months old, and it looked like this. This is horrible. This is incredibly frustrating for an endodontist. So we decided, okay, we will do the root canal treatment on the first molar, and no worries, we will do the filling on the second one. Now, I am going to show you also these pictures. So I agree the patient doesn't have the best oral hygiene, especially here. But keep in mind that this patient went to his dentist because he was in pain, but he also went to for his checkup, and this is what it looks like after the cleaning. It's not clean. You see the tartar everywhere. So very frustrating. Anyway, we did what we needed to do. We did the root canal treatment. It's not an easy isolation on this case. It was very deep. We prepared the cavity on the second molar, both occlusal and mesial, and then we did our restoration. So we just did a normal composite filling, nothing fancy, no coloring, just a simple monochromatic A2 white filling, and of course a post and a core for the first molar. So we came from this situation in 2021, where basically the only thing that was needed was 2 restorations. We ended up with this, and when I was finished with the treatment, this was the result. So instead of 2 fillings, this patient needed a root canal treatment, needs a crown on the first molar, and luckily we could save the second molar with just a filling. As you can see, the ugly really is ugly, and for me this is the main reason why I will be quitting endodontics. Don't get me wrong, I love endodontics, but after 15 years and being too bored and a little bit too frustrated, it's time for a new challenge. If you watched the complete video, thank you. It means a lot to me. If you want to watch more of my videos, hit like, hit subscribe, and turn on the notifications. I will upload a new video every Thursday. If you want to check out my previous video, you can check it out here. And it is me doing a filling. Maybe you can judge if I will be good enough to do something else than endodontics.